last production covered the axial skeleton in detail, bits and pieces of the appendicular skeleton were mentioned as appropriate. This time we'll go through the appendicular skeleton in full. We'll use the articulated skeleton, as well as a number of disarticulated bones. Let's zoom in for a closer look, and we'll get started. The appendicular skeleton is highly organized, consisting of an upper and lower division. Each division consists of a girdle, as well as the bones of the extremities. The upper division of the appendicular skeleton consists of the pectoral girdle and the bones of the upper extremities, that is, the bones of the arms, extending to the tips of the fingers. The bones of the pectoral girdle include the clavicle anteriorly. In fact, the only articulation between the upper appendicular skeleton and the axial skeleton is right here. These two articulations, one on each side, where the clavicle articulates with the manubrium. This is called a sternoclavicular joint. The posterior bones of the upper appendicular skeleton are the scapula. So again, in addition to the bones of the pectoral girdle, the upper appendicular skeleton also contains the bones of the upper extremities, the arms. The arm, or rather the bone in the upper arm, is the humerus. The bones in the lower arm, or the antebrachium, are the ulna and the radius. Notice that this arm is in anatomical position. The ulna is the medial bone in anatomical position. Distal to the ulna and the radius, I'm going to rotate now, are the bones of the wrist, the carpals, the bones of the hand, the metacarpals, and the bones of the fingers, the phalanges or phalanges. The inferior aspect of the appendicular skeleton also consists of a girdle, as well as the bones of the associated extremities. Of course, in this case, they're the lower extremities. The girdle in this case is called a pelvic girdle, and it is all of this is formed from the right and left os coxae. Each os coxa is formed from an ilium, ischium, and pubic bone. They're fused, and we'll see that in a little more detail later. The articulation between the inferior aspect of the appendicular skeleton and the axial skeleton are these articulations right here. They're called the sacroiliac joints, between the ilium and the sacrum of the vertebral column. In addition to the pelvic girdle, the lower or inferior appendicular skeleton also consists of the bones of the lower extremities. The femur and the upper leg. In the lower leg, there's a medial tibia, a lateral fibula, of course the patella, the kneecap between the femur and the tibia. The bones of the ankle are called the tarsals. The bones of the foot are the metatarsals, and the phalanges, or the bones, are the bones in the toes. We'll go over each bone now, one at a time. We'll go through the upper division of the appendicular skeleton, pectoral girdle, bones of the upper extremities. Then we'll move to the lower division of the appendicular skeleton, pelvic girdle, bones of the lower extremities. I'm going to zoom in a little bit, because we're going to start with the clavicle. This is the clavicle right here. Again, note that it is the only articulation between the upper appendicular skeleton and the axial skeleton. And again, that articulation is right here between the medial or sternal aspect of the clavicle and the manubrium of the sternum. And that joint is called the sternoclavicular joint. Laterally, the clavicle articulates with the acromion process of the scapula. So the lateral extremity of the clavicle is the acromial extremity of the clavicle. And again, it articulates with the acromion process of the scapula to form the acromioclavicular joint. Zoom in just a little more. Okay, so we're looking at the clavicle and its articulation medially with the manubrium of the sternum and laterally with the acromion process of the scapula. I have a disarticulated clavicle. I'm going to lay it right here, and you might be able to see things a little more clearly. So this is the medial or sternal extremity of the clavicle. Notice that it's broad as opposed to the lateral or acromial extremity of the clavicle. Notice how narrow it is. Also, notice that the acromial extremity or lateral extremity of the clavicle projects anteriorly. Our next bone is the scapula. This is a lateral view of the scapula. We can see the acromion process, the coracoid process. This is the glenoid fossa. This is where the head of the humerus articulates to form the shoulder. And if we go to more of a posterior view, we can see the spine of the scapula. And if you follow the spine out, you see that it actually becomes the acromion process. This is a disarticulated scapula, lateral view. There's the glenoid fossa. Again, articulates with the head of the humerus to form the shoulder. This superior process is the acromion process, which articulates with the acromial or lateral extremity of the clavicle to form the acromioclavicular joint. This is the coronoid process, which is an important muscle attachment. If I rotate the scapula posteriorly, this is the spine of the scapula. Now let's concentrate on the bones of the upper extremities. When I move out of the way, you'll see that I've placed the skeleton in anatomical position as I am standing now. Arms at my sides, and thumbs, or digit number 1, are projecting laterally. The palms of my hands face anteriorly. Okay, so the skeleton is in this position. Thumbs are here and here. Very quickly, just by overview, before we get into each individual bone, the bone of the upper arm or the brachium is the humerus. You already know that the head of the humerus articulates with the glenoid fossa of the scapula. That articulation is right here. The bones of the antebrachium or upper arm are a medial ulna. That's only going to be medial when you're in anatomical position. A lateral radius. Then the bones of the wrist, which are in this area, are the carpals. There are 8 carpals. The bones of the hand, I'm rotating things now. These are the bones of the hand. They are the metacarpals. There are 5 of them, numbered 1 through 5, where number 1 corresponds to the thumb, number 5 corresponds to the pinky. Finally, the bones of the fingers, the phalanges. There are 14 phalanges. The thumb has 2. All of your other digits have 3. I've zoomed in now. I want to focus on the humerus. And I think that with the appendicular skeleton, much more so than with the axial skeleton, it's very, very helpful to use the articulated skeleton in conjunction with the disarticulated bones. Certainly you want to use both. A lot of the things that I show you, I will be showing you first of all in the articulated skeleton, and that you will not be able to see them completely clearly. But then rest assured, I will show them to you again, disarticulated, where I can really zoom in and show them to you. But I'm afraid that if we jump right to a disarticulated bone, that you lose some of the perspective. So let's try it this way. The proximal aspect of the humerus has a head. The head is right here. And as I have already said, the head of the humerus articulates with the glenoid fossa of the scapula. That forms your shoulder. This is the greater tubercle of the humerus. This is the lesser tubercle of the humerus. important sites for muscles to attach. This is the coronoid fossa of the humerus. The coronoid process of the ulna will articulate with the coronoid fossa of the humerus. If we flex the arm at the elbow, this piece of the ulna right here, which is called the coronoid process, it goes into, I'm trying to rotate things so you can see them. So right there, the coronoid process of the ulna is going into the coronoid fossa of the humerus. Rotating now so that we can see the posterior aspect of these bones. This is the olecranon fossa of the humerus, and it articulates with the olecranon process of the ulna. In the extended position, the olecranon process of the ulna is in the olecranon fossa of the humerus. And so as you flex your arm at the elbow, the olecranon process of the ulna, the coronoid process of the ulna are articulating with the olecranon and coronoid fossa of the humerus, respectively. The part of the humerus that the ulna is rotating around is called the medial condyle, or the trochlea. And therefore, appropriately, the part of the ulna that is rotating around that medial condyle, or trochlea of the humerus, is called the trochlear notch. So this is the medial condyle, or trochlea of the humerus. On the opposite side, this is the lateral condyle, or capitulum of the humerus. Now let's go to a disarticulated humerus and see all of these things again. Okay, so I've placed a disarticulated humerus. This is actually the right humerus on the camera case. And I'm going to have to move things around a little bit, zoom in and out, and see all of these surface features. This is the proximal aspect of the humerus, distal aspect of the humerus. If we start with the proximal aspect of the humerus, this smooth articular surface is the head. One more time, that articulates with the glenoid fossa of the scapula to form the shoulder.